we will discuss a very useful remedy. That remedy I use to very frequently in day-to-day practice, the Aralia racemosa. So let us understand the deep understanding of Aralia racemosa and its clinical uses. So Aralia racemosa is the plant remedy belonging to the Araliaceae family, commonly known as American spikenard. It is prepared from the fresh root of the plant. So, the key, remembering the Aralia racemosa, the key affinity of the Aralia is has strong affinity for the respiratory system, especially bronchi, lungs, and mucous membrane. It produces asthmatic state with violent cough. Asthma with violent cough is the key indication. Miasmatically strong soric and tubercular influences, especially where there is weakness, exhaustion, and fear of lung diseases. This is not a deep destructive remedy like phosphorus, but a very important functional upper respiratory remedy in day-to-day OPD. So, Dr. Phatak summarize, describe the Aralia racemosa in one line as night asthma after first sleep with fear of lung diseases. Night asthma after first sleep with fear of lung diseases. This is very key to the prescribing. So, which type of patient you may prescribe the Aralia racemosa? Middle-aged patient, allergic asthma cases, hay fever patient, recurrent night cough patients, patients who wake up suddenly with suffocative cough. So, asthma or violent cough as soon after first sleep. Patient sleeps and then within 1 to 2 hours wake up with dyspnea and violent cough. This is the key indication or situation of the patient. Aggravation after short nap, aggravation around 11 p.m., aggravation from cold drafts. Better in sitting up and lying head high. So this is a positional respiratory relief, not a restlessness like arsenic, not a burning and hemorrhages like phosphorus, not stingy, sticky mucous discharges like calibachrome. It more about irritative cough, whistling respiration, raw burning in the sternum, acrid mucus, weak, exhausted patient. So let us understand the core or inner theme of the Aralia. Fear of lung disease with respiratory insecurity. This patient lives with an inherent anxiety. Sometimes something is wrong with my lungs. Even when reports are normal, they are not satisfied. They feel vulnerable. Their breathing becomes their center focus. Now understand the survival mechanism. When the body relaxes in the sleep, especially in the first sleep, respiratory system collapses and goes into the spasm. So loss of control during relaxation is the key. This is symptom that worse after first sleep or a short nap. The moment body relaxes, bronchial spasm appears. This is like symptoms cannot tolerate the relax. System cannot tolerate the relaxation. Emotionally, they are anxious about health, especially fear of lung pathologies, cannot shake off their fear. This is not a dramatic fear like aconite. This is a persistent health anxiety about lung disease. Fear of lung disease cannot be shaken off. Very practical. Patient may say that, doctor, I think I have TB. I think my lungs are weak. I think my chest does not feel normal. I think I have asthma. Even after investigation, their doubt remains same. They repeatedly focus on breathe, chest and cough. Breathe, chest and cough. So they Google symptoms. They are not hysterical like Ignatia or Nux moschata. They are weird and internally exhausted. So slightly weak, relaxed posture, exhausted look, mild anxiety. They are not hyperactive, they are tired and concerned. So this fear is compared with arsenic have fear of death, phosphorus have fear of being alone, Kaliyars have fear of cancer. Aconite have sudden panic. Aralia have fear of specific lung pathology. In physical generals, now weakness and exhaustion. Patient is weak, relaxed and exhausted. This is not a robust patient with asthma, and this is a tired person, chronic allergic patient, recurrent bronchitis after repeated respiratory infection. Biliousness, this is a bilious tendency, nausea, liver related discomfort, right sided abdominal pain, especially pain from the liver and liver to the right side of the scapula. Respiratory with hepatic leakage. So night asthma, right scapular pain, think of ARALIA. Modalities I have already discussed is aggravation, short nap, drafts around 11 p.m. after first sleep, ambulation by sitting up, lying head with high. So in mucus, mucus is acrid, watery, especially nasal, salty expectoration, feels warmth in the mouth. Warm, salty expectoration is characteristic. So Kalimur has bland white, Kali Beach has stringy, Pulsatilla is thick, bland, yellowish, Aralia is acrid and irritative. Sleep pattern, dyspnea, aggravation of violent cough after first symptom. First sleep is the key symptom. So this is a not at marked midnight aggravation or 3 a.m. aggravation like Caricab, midnight aggravation like arsenic album. So in particular is the main action is the respiratory. So in respiratory, asthmatic condition, violent cough after first sleep, dyspnea, whistling breathing, raw burning behind sternum, salty expectoration. So asthma after first sleep, this is not a continuous asthma. Patient sleeps comfortably and then after 1 to 2 hours, suffocative cough attack, violent cough, must sit up, feel chest is tight, wheezing with whistling sounds with fear of lung diseases. So slight expectoration gives relief, small amount of mucus comes out and breathing improves. Whistling breathing, bronchial narrowing, dry spasm with mild mucus, not heavy congestion like antim-tart. More irritation, raw burning behind sternum, this is a confirmatory symptoms. Nose, sneezing from least drop, copious watery expectoration, excoriating discharges, hay fever. So this is a characteristic allergic rhinitis remedy. I oftenly prescribe in acute allergic rhinitis to relieve the symptoms ARALIA RACEMOSA mother tincture. 15 drops 3 times a day for 5 to 6 days. The patient's symptoms get normal. Then we have to chance to prescribe a pathological remedy, constitutional remedy or antimiasmatic remedy. Drops sensitivity is marked. Even slight air exposure to air causes sneezing. Nasal discharge profuse, watery, acrid causes burning. So allergic rhinitis lead to bronchial tendency. Upper respiratory irritation, then upper proceeds to asthmatic attack. In mouth and throat, aphtha, as if foreign body in the throat, nausea in the throat. Foreign body sensation is interesting. Patient may say that something is stuck into the my throat. Nausea in the throat, not gastric nausea, but throat based discomfort. Abdomen, right liver to right scapula. Pain extending from liver to the right scapula. Bilious patient, right-sided pain with night asthma. So, so we have to differentiate much more remedies which are very close to the ARALIA RACEMOSA. First remedy is arsenicum album. Similarity is night asthma, must sit up. Arsenic has intense fear of death with restlessness. ARALIA has specific fear of lung diseases but less restlessness. Arsenic is chilly, wants small sips of water frequently. ARALIA is weakness present with not extreme chilliness. Arsenic attacks after midnight, after 1 to 2 p.m. Aralia has soon after first sleep. So arsenic has a panic asthma, Aralia has a first sleep asthma. Then another remedy is Kali carbonicum, and both have night asthma. Kali has rigid, congestive, anxiety and security. Aralia is more of health focus fear. Kalika aggravation 3 a.m. sharply. Aralia soon after first sleep. So Kalicarb has stitching pain with back weakness, constipation, excessive sweating, 3 a.m. aggravation, while Aralia early sleep asthma is the key. In Antimtard, breathing difficulty. Both have common breathing difficulty. Antimtard is dull, sleepy, passive. Aralia is anxious about lung diseases. Antimtard has rattling chest with fill of mucus. Aralia has more spasm, less rattling. If chest sounds full of mucus, it is not a Aralia. Antimtard is rattling in the lungs, Aralia is whistling in the lungs. So, after putting a stethoscope on the lungs, on the chest, we may clearly distinguish the Antimtard and Aralia. In another remedy is the Ipecac. Ipecac both have similarly asthma with cough. Mentally, Ipecac is irritable. Aralia has fear of lung diseases. Ipecac has persistent nausea, clean tongue. Aralia has throat nausea in the throat, not a gastric dominance. Ipecac nausea with asthma. Again, Aralia with first sleep asthma. Another remedy, phosphorus, burning chest and fear of lung diseases. Phosphorus is open, affectionate, fearful, being alone. Aralia is more internally anxious about the lung diseases. In physical difference, phosphorus is a hemorrhagic tendency, Aralia is not. Phosphorus has burning with bleeding, Aralia has burning with first sleep attack asthma. Another remedy is the Sambucus nigra, night suffocative attack. Sambucus has often in the children. Aralia is more about the allergic type. Sambucus has dry, blocked nose at night. Aralia has acrid discharges. Sambucus has dry nose night with suffocation with profuse perspiration is the key for Sambucus. Aralia has watery nose with asthma. So these are the common remedies that are come close to the Aralia racemosa. So as Dr. Phatak gives complementary remedy is the Lobelia inflata. So why this Lobelia is complementary? We must understand these remedy relationship. It will very helpful to prescribing remedy and completing the cure, or if first remedy fails and you know the complementary remedy of that remedy, you can have much more results. So both have action. Lobelia is complementary to the Aralia racemosa. Both have action on respiratory, asthmatic status, bronchial spasms. So when we need to shift from Aralia to Lobelia, asthma becomes more spasmodic. There is more respiratory and respiratory connection. Nausea becomes dominant. Patient feels that constant with sinking. So, in lobelia, a peculiar sensation of severe salivation with nausea. Aralia has first sleep bronchial spasm. Lobelia has bronchial spasm, spasmodic asthma with gastric involvement. In acute and chronic relationship, Aralia works beautifully in acute allergic condition, recurrent seasonal asthma. So remedies that follows well to the Aralia is arsenic with if anxiety become intense with restlessness, phosphorus if burning and hemorrhagic tendency appears in that patient, Kalikab if the fixed 3 a.m. aggravation develops. So when not to shift or when not to change the remedy, same modality persistent, same mental picture persistent, positional relief exists with whistling respiration, don't change, may we need to increase the potency. So the totality for prescribing the ARALIA asthma with violent cough occurring after first sleep or after short nap, better by sitting, high head up, fear of lung diseases with marked respiratory anxiety. Acrid watery nasal discharge, whistling breathing, raw burning sensation behind the sternum, warm salty expectoration. In potency, as I have already told, I use mother tincture for allergic rhinitis or in the asthma, but if the peculiar key symptom is found, then 30 and 200 potency mostly useful. So the summarizing the ARALIA racemosa is first sleep aggravation, bronchial spasm and lung anxiety. These three symptoms with allergic tendency, first sleep aggravation, bronchial asthma and lung anxiety is the key for prescribing ARALIA. So thank you very much for patience listening. This is all about ARALIA racemosa, a great remedy for day-to-day practice. Thank you very much. See you in the next live session. Thank you.